We identified 89 new cases in the last 24 hours. There are now 1,169 active cases in the province. Currently, 48 people are in hospital, including 11 in intensive care. Tragically, I am reporting one additional death today. My heartfelt condolences go out to anyone who has lost a loved one, whether to COVID-19 or any other cause during this pandemic. The lab has completed more than 8,000 tests in the last 24 hours. We expect to add thousands of tests to this total this week and next. Alberta's 90,000 teachers and school staff working in schools have been invited to get tested before the start of the school year. That's a lot of tests in just a few weeks. So I'm very pleased to announce that Shoppers Drug Mart and its parent company Loblaw Canada are taking on an even bigger partnership role in offering testing in communities right across the province. More than 50 Shoppers Drug Mart locations and pharmacies in Real Canadian Superstores already offer asymptomatic testing. Under a new agreement with Alberta Health Services, within the next 2 weeks, all 234 Alberta-based affiliated pharmacies in Loblaw-owned stores will offer COVID-19 testing. The Loblaw family of stores includes such familiar names as Superstore, Wholesale Club, Extra Foods, No Frills, Independent, and Loblaw City Market. Thank you to Shoppers Drug Mart and Loblaw for making testing highly available in every community, including, and maybe especially, outside of the big urban centres. Overall, it increases Alberta's testing capacity by about 3,000 to 4,000 tests a day. That would serve half or more of Alberta's teachers and school staff. We will need this added capacity, plus that of all community pharmacists who are already testing for COVID-19, if we are to test these 90,000 teachers and school staff in just a few weeks. With that in mind, I repeat my request to teachers and school staff to book your test now and do not leave it to the last minute so that volume does not overwhelm the system. I also repeat my request to anyone who does not work in a school setting, who feels completely well and who has not had an exposure to COVID-19. Please hold off getting tested until later in September. For children, testing is only recommended if there are symptoms or a medical condition such as allergies that can mimic COVID-19 symptoms. Parents need to arrange testing for these children through Alberta Health Services. Pharmacy testing is only for those with no symptoms and no known COVID-19 exposures. Testing for anyone who has symptoms or known exposure to COVID-19 must be arranged online through Alberta Health Services at www.ahs.ca/COVID. You cannot go to a community pharmacy for your test. Thank you to Shoppers Drug Mart and pharmacies and Loblaw stores for stepping up to help test the educators of our children. Thank you to all the community pharmacies who are already providing this valuable service to Albertans to support our COVID-19 surveillance. And I invite all remaining community pharmacies to consider joining in offering asymptomatic testing through the voluntary pharmacy testing program. For Albertans who are wondering if their local pharmacy is providing testing, you can go to the Blue Cross website and check to see which pharmacies in your area are providing testing at this time. The knowledge we gain from testing will inform future pandemic-related public health decisions and will be a foundation of learning for years to come. Testing is a powerful tool, but even more powerful are the other measures, such as staying home when sick, staying distanced from those outside your household or cohort, wearing a mask when you can't, enhanced sanitizing and washing hands to minimize spread. The best thing we can do to prepare for a safe re-entry to school is to keep our community transmission low. We are currently sitting at an average about 2 new cases per 100,000 population over the past week per day. This compares with average new daily case rates of over 25 per 100,000 in Florida, Georgia, and Texas, where school reopening issues have been identified. In fact, our average new daily case rates per 100,000 are lower than almost all of the U.S. states, with the exception of New Hampshire, Maine, and Vermont, which are sitting at approximately 1.5 new cases per day per 100,000. This indicates that we are in a different context than states where we are watching some of those issues take place. And we need to strive to make sure our community transmission is as low as possible. We are working on an outbreak guidance document that should be ready to be released within the next week, and that will have very specific guidance for all of those kinds of scenarios. I know that parents, teachers, school staff want to have all of that specific information so they can be making plans. What I can tell you right now is that if you have one symptomatic child who is in a classroom, it would depend on when their symptoms started, whether they attended school while they were symptomatic. Let's say, for example, a child who is attending school regularly gets sick on a Monday morning and they're kept home by their parents, they arranged for testing, and let's say that test is positive for COVID, but if their symptoms started on a Monday and they hadn't attended school on the Saturday or Sunday, there would be no significant exposure in the school, and therefore there wouldn't be a requirement to isolate or quarantine close contacts. If, however, you had a student who was symptomatic while they were at school and they were sent home, the simple fact of symptoms would not require those in the classroom to be in quarantine or isolation. What would happen is there would be encouragement of the parents to have that child brought for testing. If the child tested positive for COVID, then that public health investigation would go into who the close contacts would be and whether or not, again, in that case, if the child attended while symptomatic, if there were exposures, and those who would be in close contact would be required to quarantine. So it really depends on each individual scenario, and that initial investigation about was the child in school while infectious, if they were, who were their close contacts, and then those are the individuals who would need to stay home, get tested. And you mentioned the sibling. Certainly if there's a sibling of a child who's a confirmed case, that sibling would need to be at home and tested, but unless they themselves were a confirmed case of COVID, then their class wouldn't necessarily need to be isolated. So the question about the number of cases it would take to close a school, it would really depend on, again, what the circumstances were. We don't have a specific number threshold. What happens with even a single case is that public health would be working with the school to identify close contacts and making sure that close contacts were staying home, getting tested. And if there were a significant number of close contacts, or if there were many cases, if it seemed like there were large-scale exposures or lots of spread, those are the kinds of things that would be taken into account. And it would be a joint decision to close an individual school between local public health, the school, the local school board, with discussions with the Ministry of Health and Education, because it really is, there's not one single threshold that would make that decision. It's a case-specific and context-specific decision. The question about Calgary Board of Education and Calgary Catholic requiring masks for all ages. What we've done in our provincial policy is we've looked at the evidence around masking, the evidence around transmission, and what we currently know with respect to COVID-19 in younger children versus older children. And our recommendation provincially is based on what we understand to be the best provincial standard. Individual school boards may be looking at their own epidemiology and their own circumstances. They perhaps know the children in their schools and behaviors and the capacity to wear masks or not, and making decisions based on that local understanding. And so that certainly is within the ability of school boards to make those decisions. And so that, again, is what some school boards like Edmonton and Calgary school boards have done. But it really doesn't change that provincial assessment that we've made of the currently available evidence and what we believe is best across the entire province.